was just very self-conscious of it, and whatever sort of personal feelings anyone has, then it kind of relates to them perhaps more than to other people. I don't think anybody said anything to me, but it was just my own self-consciousness of it which was the main driver for having the procedure carried out. My name's Jonathan Stewart. I'm here at the Harley Street Hair Clinic to talk about my hair transplant, which I had carried out a year ago. I work in clinical research. I trained in medicine. I spend most of the time working for biotech companies, investigating new treatments for conditions involving the central nervous system. It was in my mid-30s that I started to notice that there's hair loss in the crown aspect of my head. And at first, I didn't try and cover it up. I accepted it, but I did become more self-conscious of it as the years progressed into my early 40s. I did try then covering it up with topical powder agents, which although were effective, it was quite messy, and I was looking for a more permanent and satisfactory way to deal with the hair loss. I had done some research looking in newspaper articles and the internet to identify clinics which carried out this procedure. And because it's quite a visible procedure, I wanted to choose a reputable organisation. I probably had more questions because of the medical and science background about the procedure, the evidence base for the procedure, the results at 6 months, 1 year, 3 years, 5 years. And I wanted to meet the staff and the surgeons who would be carrying out the procedure, because as someone who's trained in medicine, I know the importance of who's carrying out the procedure regarding outcomes. And the clinics that I visited didn't always utilise medically trained staff to perform the transplant procedure. And for me, it was important that it was someone who was medically qualified, who had a good training and expertise in this procedure, which was going to involve a very visible part of my body. So the fact that this clinic here uses medically trained staff was an important consideration in my choice. The establishment and surroundings here are very modern, very open, very light, and importantly, very clean. And you know, for me, the importance of a clean, sterile environment when a surgical procedure is being carried out is probably the single most important thing to bear in mind when choosing a clinic. The procedure was over 2 days, so I had mine carried out on a Monday and Tuesday. They usually started about 10 o'clock in the morning. We were finished by 4 in the afternoon with a break for lunch. There was a television in the clinical space where the procedure, in the theatre where the procedure was being carried out, and so you could watch movies or listen to music. There is a certain amount of patience that's required. This isn't a sort of overnight fix. There's follow-up visits at 6 months and 12 months to review progress. And yes, it can take up to 12 to 18 months to see the full results. So there's a bit of a waiting game, but that's fine, because at the end of the day, you know, you want these results to last for years. The results are very good, and I've certainly felt a lot more calm and peaceful within myself having had the procedure carried out, and less self-conscious.